Hi, good day. My name is Masi Anbibaling from BSN2 Weidenbach. So for today's video, I am going to show you the procedures about the administration of oral medications. But what is oral medications administration? It is the giving of medication to be swallowed through the mouth. The objectives are, number 1, to ensure that patient metabolizes medication without feeling of nausea or vomiting. Number 2, to offer the most common, easiest, and least expensive route of administering medication. And last is to provide a sustained drug action and increased absorption time. Now, let us proceed to the procedures.
Step number 1. Gather equipments. After gathering the equipments, check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Number 2 is to know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. After that, perform hand hygiene because hand hygiene deters the spread of microorganisms. After that, place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Next is to transport medications to the patient's bedside carefully and keep the medications inside at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. After transporting the medications, identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Next is to explain the procedures to the patient to gain cooperation and to allay anxiety. After that, assist the patient to an upright or lateral position. Swallowing is facilitated by proper positioning, and upright or side-lying position protects the patient from aspiration. Next is to administer medications. Offer water or other permitted fluid with pills, capsules, tablets, and some liquid medications. Ask whether the patient prefers to take the medications by hand or in a cup. Liquids facilitate swallowing of solid drugs, and some liquid drugs are intended to adhere to the pharyngeal area, in which case liquid is not offered with medication. This encourages the patient's participation in taking the medications. Next is to remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Unless the nurse has seen the patient swallow the drug cannot be recorded as administered. The patient's chart is a legal record. Only with a physician's order can medications be left at the bedside. After that, perform hand hygiene but leave the patient in a comfortable position. After leaving the patient, perform hand hygiene because hand hygiene prevents the spread of microorganisms. Last step is to check on the patient within 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effects of medications.